Welcome, everyone. Let's jump right into today's explainer, because we're unraveling a medical true crime story that honestly has all the makings of a Hollywood blockbuster. We are talking about a deadly biological heist, a microscopic mastermind, and a totally cold case that baffled the absolute greatest medical minds for decades. Before we even name our culprit, just imagine an assassin so stealthy it leaves no immediate trace, strikes with devastating lethality, and then just vanishes back into the shadows. Get ready, because we're investigating the fascinating, terrifying, and surprisingly sneaky world of the hantavirus. Okay, put yourself in this scenario for a second. You're on the front lines of the Korean War. The tension is incredibly high, the environment is harsh, but the most devastating attack you face, it doesn't come from enemy artillery. It doesn't come from a covert ambush. It literally comes from thin air. You have to ask yourself, what kind of completely invisible enemy could wipe out over 3,000 soldiers without a single bullet ever being fired? Well, this was the exact terrifying medical mystery confronting United Nations and U.S. troops in the early 1950s. So let's dive right into this and crack open the first chapter of our case file, the mystery at the Hantan River. For years, troops stationed near this small, seemingly peaceful river in Korea were falling severely ill, and it was bizarre. They had a rapid combination of high fever, systemic shock, and acute renal failure. Medical professionals were, frankly, completely stumped. To really understand just how baffling this outbreak was, we have to look at the timeline. We're talking about vague rumors of similar clinical entities dating all the way back to the Middle Ages in Europe and China. But it wasn't until that window between 1951 and 1953 that the global medical community was essentially forced to take notice. Those 3,000 soldiers struck near the Hantan River, they faced a terrifying 7% mortality rate. And yet, despite the urgency and despite having the top medical sleuths on the case, the culprit remained completely at large for more than 2 decades. Can you imagine the sheer frustration? It took an agonizing 25 years until 1978 for a determined researcher named Lee and his team to finally isolate and officially identify the Hantavirus. It's honestly a little comical to imagine medieval knights scratching their heads right alongside bewildered 1950s soldiers, all just completely defeated by an invisible foe. But that highlights a very serious historical reality. This virus, which we now know belongs to the Bunyavirdae family, absolutely outsmarted humanity for centuries. It just hid right in plain sight, comfortably thriving in its natural habitat, waiting for someone with a very big magnifying glass and a whole lot of patience to finally catch it in the act. So, if the virus is the microscopic mastermind of this whole operation, who exactly were the getaway drivers? We need to transition our investigation to the primary suspects out in the field. Let's talk about the unwitting henchmen who carry this biological weapon across the globe without ever actually taking a single sick day themselves. The biological steps of this infection are incredibly specific. It functions almost like a perfectly planned heist. Step 1 is coevolution. The virus and its host, specifically murid rodents like mice and rats, they've evolved together for so long that the infected rodents don't actually get sick. They're the perfect oblivious carriers. Step 2, the rodents leave aerosolized excretions, urine and feces out in the environment. And step 3 is the tragic accident, human inhalation. You breathe in the dust and the heist begins. Now, importantly, humans are almost always a dead-end host. That means the virus effectively traps itself inside us. We don't pass it on to other humans, so the chain of transmission stops right there. Though, quick scientific side note, there is one incredibly rare exception with the Andes strain Sultan in Argentina, where person-to-person transmission was reported. But generally speaking, you're getting it straight from the animal source. And this really brilliantly illustrates exactly how that accidental transmission goes down. Our unwitting rodent friends just proudly scamper around carrying their toxic backpacks, dropping little invisible clouds of trouble wherever they go. Then, an unsuspecting person comes along simply to sweep out their shed, or maybe clean a dusty attic, and they kick up a microscopic storm. By just doing everyday chores, they accidentally inhale weaponized rodent droppings. It's a classic, tragic case of being in the absolute wrong place and breathing in the wrong dust. Once inside the human body, this microscopic criminal doesn't just have one method of attack. No, it has 2 entirely different, equally devastating strategies. Let's dig into the modus operandi of the culprit and look at the 2 distinct, deadly syndromes it triggers. The map of this biological crime scene is essentially split right in half between the old world and the new world. In Asia and Europe, we see Old World hantaviruses causing HFRS, that's hemorrhagic fever with renal syndrome. This variant ruthlessly targets the kidneys and systemic capillaries, with lethality rates hitting up to 15%. And 15% is already a highly terrifying number. But meanwhile, in the Americas, New World hantaviruses cause HPS, human pulmonary syndrome. This variant is uniquely brutal. It shifts its target to the lungs, and lethality rates skyrocket to an astonishing 50%. Literally half of the people who contract this variant may not survive the encounter. It's a grim reality that manifests in horrifying extremes within the body. You either have an exhausted, shutting down kidney in HFRS, or literally drowning lungs in HPS. But both of these deadly syndromes actually share a common underlying tactic. They cause severe, widespread capillary leakage. Your microscopic blood vessels essentially become porous. Depending on your geography and the specific viral strain, that leaking fluid fills different vital organs. In the case of HPS, the capillary leakage is so profound and so rapid that a patient's lungs can literally fill with their own fluids, eventually weighing twice as much as a healthy average lung.
If we zoom in on the Old World variant, HFRS, it is an absolutely grueling roller coaster ride for the patient. You start with the febrile phase. This is a blazing high fever and severe backache. Then the bottom drops out entirely into the hypotensive phase, where blood pressure violently plummets and patients can crash into full systemic shock. Next comes the grim oliguric phase. This is where the kidneys effectively shut down completely, and internal interstitial hemorrhage hits its peak. If the patient is incredibly resilient and actually survives this gauntlet, they hit the diuretic phase, where that trapped fluid finally releases. But it doesn't even end there. They are then faced with a long, utterly exhausting convalescent phase that drags on for up to 6 months, draining every ounce of energy as the body slowly attempts to rebuild itself.
But here is where we reach the major plot twist of our true crime story. Because the absolute most shocking part of this biological heist isn't what the virus destroys. Actually, scratch that. It's what it doesn't destroy. What is absolutely wild here is the sheer audacity of this virus. Instead of acting like a wrecking ball, violently destroying host cells as it replicates, like most pathogens do, the hantavirus acts like a smug VIP, essentially tickling the cell's bouncer. It has a golden ticket. It does not destroy the cells it infects, specifically the macrophages and vascular endothelial cells. There is absolutely no visible cytopathic effect, none. It just sneaks in, replicates quietly in the background, and tricks the cell into relaxing its borders, which is what eventually causes that massive, deadly fluid leak. Grounding this metaphor in the hard science, that VIP bouncer at the cellular club is actually a critical cellular surface receptor called alpha-V beta-3 integrin. Normally, this integrin is an incredibly strict manager. Its entire job is to regulate cell adhesion and keep the vascular barrier completely tight and leak-proof. It is literally the guardian of the walls. But pathogenic hantaviruses specifically bind to this exact receptor for entry. It is so incredibly devious. By engaging the very mechanism that is meant to keep the barrier secure, the virus essentially hijacks the security system. It tricks the endothelial cells into opening the floodgates, all while leaving the cell physically intact and completely unaware of the sabotage. So, wait. If the virus isn't actually blowing up our cells itself, why do people get so incredibly sick? Well, prepare for the tragic irony of this entire infection. The ensuing chaos is explosive. The body detects the viral intruder, hits the absolute panic button, and sends in a ridiculously overly aggressive police force of immune cells. They rush to the scene and start tossing biological grenades everywhere in a desperate attempt to clear the virus. But in the ensuing crossfire, this massive overreaction ends up accidentally blasting holes right through the patient's own vascular walls. The deadly fluid leakiness isn't just a clever trick of the virus itself, it's the result of a catastrophic, misguided assault by our own biological SWAT team. The crucial point here is that understanding this immune storm is the absolute key to understanding the disease. The body releases a massive flood of cytokines. These are those biological grenades I just mentioned, specific proteins like TNF-alpha and IFN-gamma. At the exact same time, CD8+ cytotoxic T cells rush to the site of the infection. And here's the kicker. The higher the number of these T cells, the more severe the patient's disease becomes. And what's even more fascinating and frankly tragic is the role of the genetic lottery. If you happen to carry specific genetic alleles like HLA-B8 or B35, your immune system is basically hardwired to trigger a much more severe, life-threatening vascular dysfunction. Your body's alarm system is fundamentally set way too sensitive, turning a defense mechanism into a fatal overreaction.
We've seen the crime, we've identified the microscopic culprit, and we've analyzed the tragic friendly fire. Now, let's shift to our final chapter. Let's look at how modern medicine plays detective to catch this invisible enemy in the lab, and how we're actively trying to build defenses for the future. On the diagnostic desk, doctors have to meticulously piece together specific clues. And this is tough, largely because the initial symptoms start off feeling exactly like a bad everyday flu. If a patient presents with a fever, severe back pain, signs of renal failure, and was recently doing outdoor activities like camping or cleaning out a barn, massive alarm bells should immediately ring. In the very early phase, a sudden drop in blood platelets, what we call thrombocytopenia, is a huge hint for clinicians. But to truly nail the conviction and confirm the virus, labs must use an ELISA test to hunt specifically for NP-specific IgM antibodies. And just a quick word of caution for the medical sleuths out there running these labs, there was a highly tricky cross-reaction to watch out for. Pulmonary tests can often cross-react with the Hantavirus, though strangely enough, it doesn't work the other way around. Let's see how all of this builds into our clinical response, because this knowledge directly informs our treatment and prevention strategies. The truth is, right now, we simply don't have a magic bullet. Older antiviral drugs like ribavirin showed some early hopeful promise for treating the kidney-related HFRS, but they completely missed the mark for the aggressive lung-attacking HPS. So medical care right now is strictly supportive. We're talking intensive ICU monitoring to keep the patient's blood pressure and oxygenation stable while they ride out the storm. On the prevention side of things, keeping rodents far away from human habitats remains rule number one. But the real impenetrable fortress of the future? That lies inside the laboratory. Older killed virus vaccines, like Hantavirus, unfortunately showed rapidly declining immunity over time. So the world's top researchers are now working around the clock to build next-generation recombinant DNA vaccines, hoping to provide a lasting, impenetrable shield for those at risk. And that brings us to the very edge of our current scientific understanding. We are locked in a microscopic arms race against a truly invisible enemy, one that brilliantly uses our very own biology and immune systems against us. So I want to leave you with this provocative thought. As we continue to decode the intricate genetic playbook of the hantavirus, what revolutionary new fortress will medical science build to finally wall off this invisible enemy once and for all? Thank you so much for joining me on this explainer. Keep asking those big questions, stay endlessly curious, and I'll see you next time. Welcome.